I'm going to do a little demonstration here of disinfecting and sanitizing this office space. Once again, the disinfectant that we're using is EPA registered as being completely non-corrosive and will not hurt anything that we spray it on. Fine fabrics even. I could spray it on a painting. It won't even hurt that. It's also approved to be sprayed on fine electronics, even computers that are running now. These computers are not running right now, but I'm going to go ahead and disinfect them. This whole office area here, the keyboard. The important thing you have to remember is that when you're normally doing disinfecting with a towel or a wipe, all you can do is the top here. You can't get underneath the keys where the pathogens and the contaminants are living. Same thing with the telephone here. You can wipe down the top and everything, but you can't get inside where all the buttons are and everything else. On the screens here, you can do the front, but you can't get all the nooks, all the crannies. Take a look at this calculator here. I mean, it's easy to see how all the contaminants can live underneath the whole front of the working panel here. So we're going to get all of this right now, and you can see how easy it is. So I'm going to start at the top of his credenza. And now I'm going to do that laptop right there, keyboard here, because the disinfectant is coming out at 60 psi, so that mist is penetrating everywhere, deep inside of everything. On the phone and back of the phone. Will not hurt the paper in there. If there happened to be food sitting out here, I could spray the food as well. Will not hurt the food. And in about 10 to 15 minutes after the disinfectant has completely evaporated, come right back in and get to work again. There's no downtime for using our system of sanitizing and disinfecting. Okay, we're going to do the swab test for this floor. The designated place is right here on this desk. We will start up the luminometer, let it calibrate. Takes 15 seconds as always. Okay, let me check to make sure we're at the right location. We are on the luminometer. Take the swab and we'll swab right over here. Very good, that should do it. And that's the place we'll test after we're done with the disinfecting. Activate it. Give it a little shake. And we'll put it in. There we go. And in about 10 seconds we'll know what the level of contamination is on the surface of this desk. Pre-treatment, of course. 7,447. Okay, you saw we did the luminometer test before we did the disinfecting and sanitizing, and it was well over 7,000. We've completed the sanitizing on this floor, and now we're going to go ahead and do another swab test with the luminometer right now and see how effective the treatment was. So I'm going to turn on the luminometer and let it calibrate itself. Okay, it's ready. Let me make sure it's in the right place. It is. Good. Right location. Take the swab. And we're going to swab same place I did before. Nice and thorough. Put it in. And we'll see what the results are. Just a little bit more. Okay. And press it. Drum roll, please. Six. We took it down from over 7,600, I believe, if memory serves me correctly, down to 6. Pretty impressive. Restrooms are an area where it's almost impossible to sanitize and disinfect them completely using the old standard spray and wipe methods with cloths and sponges, stuff like that. You cannot get your fingers into every nook, every cranny, and to all of the little spaces that have very, very small clearances. Whereas the technology that we use, because we're spraying out this disinfectant at 60 psi in an atomized form, gets everywhere. And I'm going to do this toilet right now very quickly just to show you. Everywhere, every nook, every cranny. You couldn't even take a Q-tip and get into some of the areas that I just disinfected. Now over here, of course, is the sink. Another area that's very, very difficult because of all the small areas around the faucets, the knobs, underneath in the back here. Once again, very efficient. And now the underside, including the back. And we'll even disinfect the soap, just to make sure we got it all. Okay, now we're going to do a swab test in a bathroom. This was the swab testing point chosen for this floor of the building that we're sanitizing right now. So once again, I'm going to turn on the luminometer, and it's going to calibrate. It takes about 15 seconds. Okay, now it's calibrated. Now I have to choose the right location for the swab test. Okay, we now have it selected to the correct location. So what I'm going to do now is I'm going to take the swab and we're going to use a handrail. Fairly commonplace that people would touch when they're in the restroom. Alright, I think that's probably pretty good. And now we'll go ahead and we will activate it. Shake it for a couple seconds. and we'll put it in the luminometer. And here we go. Now remember, the safe zone that we're shooting for after we're done sanitizing is between 30 and 100. We're going to find out now what it is before we do our sanitizing. 666. Can you see it? Okay, so after the sanitizing, of course, we're shooting to get this down to between 30 and 100, the safe zone. Okay, we've finished disinfecting and sanitizing this floor, and we're going to retest the designated swab testing point. So we're going to go ahead and start up the luminometer again and let it recalibrate itself. Okay, so I'm going to take the test thing and swab in the same place that we did to begin with, and put it in here, activate it, and put it in. Here we go. Okay. $34. Took it down from 666 all the way down to 34. Excellent. Okay, well, it shows you the effectiveness of the protocols and the technology that we're using. Another place that normally never gets disinfected or sanitized during normal janitorial cleaning processes, for instance, on the ceiling, the light fixture is nice and warm, a great place for pathogens to breed and stay. And also the vents, because there's constant air moving, they're sucking in all the pathogens and contaminants, and very rarely does anybody ever do them. And once again, with our technology, it's quick, efficient, works beautifully. These are the vents. And the light fixtures. Now, you'll notice that these light fixtures are on. There's actual juice running through them. Now, because our formula and the way we apply it is non-flammable, we don't have to worry about any sparks or electricity or anything else. We can actually spray computers that are running. So I'm going to do the light fixture right now. I dare say that's probably the first time that's been disinfected or sanitized since it was installed. When we're sanitizing and disinfecting using our technology, we can sanitize literally everything. Things that normally don't get sanitized, such as these chairs, which people sit in every day. People cough, they blow their nose, who knows what else, and then they put their hands all over them, and the pathogens stay on them virtually forever. Once again, using our technology, we can sanitize and disinfect very efficiently. I'll demonstrate right now. Now once the front of the chairs are done, and the tops, now we do the bottoms, which once again no one normally ever sanitizes or disinfects. And in a few moments, I'll finish it off by just turning the chairs around and doing the backs and the undersides. Large areas such as these conference room desks, once again, easily done, tops, underside, sides, everything. Then the undersides are done. All the nooks and crannies, all the areas that would be virtually impossible to get by hand, quickly and efficiently.